Each year, more than 790,000 Americans get a knee replacement, a number expected to reach 4 million by 2030. Yet many delay treatment, believing joint replacement is for older adults, or the recovery will take too long. But this isn't your grandparents' knee surgery. New personalized implants are helping patients recover faster and stay active longer. Eric is a 65-year-old scientist, international weightlifting official, and former dancer. We got to dance later, Eric, okay? Who's back to his managed schedule after a total knee replacement. His story caught the eye of Arnold Schwarzenegger, who called him personally to congratulate him on his recovery. Eric joins us now with orthopedic surgeon Dr. John Klibanoff, VP Global Medical Education for Zimmer Biomet. Eric, doctor, how are you?
Very well, thanks.
Good morning. Well, thank you.
Thank you so much. Eric, when was the moment you knew you couldn't keep living with your knee pain?
Well, I was suffering with some pretty severe knee pain for over 3 years, and I was trying to convince myself that it would get better. I was trying to take some temporary treatments to get through it, but that didn't work. It just got worse over those 3 years, and it got to the point where I couldn't enjoy my activities anymore. I couldn't travel for work or for vacation, and it was even difficult to walk my dogs. And then about 1.5 years ago, I was going to my doctor to get another knee injection, which had not offered me much relief. And he had already informed me about the modern surgical techniques and the modern implants used for knee replacement surgery. And I decided then and there not to continue with the knee injections and schedule the surgery.
Doctor, how big a problem is osteoarthritis and the need for knee replacements now and in the future?
Unfortunately, it's a very large problem, and you alluded to it earlier. 800,000 implants done last year, and by the year 2030, we do expect about 4 million. And 60% plus of those individuals are under the age of 65. Too many of them will delay treatment, and that condemns them to live in pain that they don't need and to have decreased mobility of their joints. And at the same time, this population is trying to stay active into their 70s and 80s, and those two things just do not mix well.
Now, doctor, have advances in knee replacement technology changed patient outcomes compared to traditional implants?
Yeah, they really have. And if we look with the population to start with that are over the age of 50, these are people who play pickleball. 12,000 of them ran in the New York City Marathon last year. And 600 million people around the world suffer from arthritis, yet only 5% of people are seeking treatment. So companies that innovate to try and close that gap are important. And that's what drove me to join Zimmer Biomet. It's that increased need for awareness, which is why Eric has partnered with us in the initiative. And as a company, we've looked at massive amounts of data on what joints are in terms of their size and shape. We've tried to innovate through full replacements, partial replacements, personalized implants, implants that actually allow us to help track postoperatively the position of the knee in space to help with recovery, called a smart implant or Persona IQ. And when we mate those things together, what we find is that the outcomes are better. Patients recover more quickly, they have less discomfort, they're more satisfied with their knee replacement, and they can remain active far longer into their 70s and 80s than previously.
Eric, how is your recovery, and how surprised were you when Arnold Schwarzenegger called you?
Well, James, I think everybody's recovery is going to be different, but I had done my homework and I was prepared. And honestly, it was a lot easier than I thought it would be. I was literally walking out of the hospital 2 hours after the surgery. I was able to navigate up and down stairs when I got home. And I finished the pain med just a couple of days later, and I was able to drive my car. I was faithful to my physical therapy, and now a year later, I'm back to all my old activities. I'm at the gym every day. I'm traveling internationally. But the highlight of my recovery has to be coming in 6 weeks when my daughter's getting married. And thanks to my new knee, I'll be able to dance at her wedding, whether she likes it or not.
Just don't moonwalk. Don't moonwalk on her.
It's still my job to embarrass her when I can, but I'll try to refrain.
Doctor, what misconceptions do you see most often about knee replacement, especially among younger active patients, where they can go for more information?
I think the message there is very clear. There's an awareness gap. Take a page from what Eric said earlier. He was prepared, but where do you receive that preparation? So our campaign, you'llbeback.com, it has information relevant to patients that are young. It talks about how to find a doctor if you don't have one through our physician finder portal. It has information about arthritis, information about recovery. And utilizing that, we hope to close that gap so that nobody is living unnecessarily with pain. You'llbeback.com is where you get that information.
I've been speaking with Dr. John Klibanov, VP Global Medical Education for Zimmer Biomed, and Eric, a 65-year-old scientist who's about to embarrass his daughter at the dance at her wedding by doing the moonwalk and a little jitterbug. Gentlemen, thank you so much for joining us. I'm watching you here. There you go. Thanks, guys.
Thanks, James.
Thanks.